So today we're going to be covering the topic of slipped discs. Today's video is going to be a little bit longer than usual, so there'll be a little bit more information in it. But the three areas that we're going to be discussing is what is an intervertebral disc, do intervertebral discs slip, and then management of treatment of intervertebral disc related pathologies. So, what is an intervertebral disc? An intervertebral disc is a fibrocartilage structure that makes up part of your spinal column. They act as a shock absorber for your spinal column. They create space between the vertebrae, preventing from your vertebrae from grinding on each other. And then they also allow for flexibility of the spinal column without sacrificing strength. You have 23 of these in your body. There's 6 in your cervical spine, 12 in your thoracic, and 5 in your lumbar. Of these intervertebral discs, they are comprised of 3 portions. You have the nucleus pulposus on the outside, you have the annulus fibrosus on the inside, and then you have the cartilaginous end plates on the top and bottom, which connect these intervertebral discs to the vertebrae, creating that stability of the spinal column. That's a little bit on the intervertebral disc, and now we'll discuss if they slip. So, do intervertebral discs slip? No is the quick answer. You have the potential for a disc to prolapse or to bulge, but you will never find a intervertebral disc slipping out of the spinal column. If we were to think of an intervertebral disc as a jam donut, you have the outer portion, which is the dough, the casing of the donut, and then the inner portion, which is the gel, the jam in the middle. So essentially, if we look at that as an intervertebral disc between 2 vertebrae, if we were to bend forward and push on one portion, the front portion of the donut, that jam would more than likely push out of the back if we were to push it hard enough. And this is essentially what can happen with intervertebral discs. You can get prolapses and bulges if we have excessive force for sustained periods of time on these discs. You can also get prolapses, herniations, and bulges as a result of just degenerative change, age-related changes that can occur naturally. And it is really important to consider that very commonly we can have a intervertebral disc bulge or herniation and have absolutely no symptoms. But in some cases, and a lot of the time, you can find that prolapse or that bulge can impact on an exiting nerve root from the spinal column and cause that irritation to the nerve root. And that's where we get these symptoms of nerve pain, electric, like sharp shooting pain down the leg, altered sensation, numbness, those sort of symptoms, loss of muscle power as well. So that's just a little bit of information. In short, no, intervertebral discs do not slip, but they can prolapse, herniate, or bulge. So, on to the final topic, management and treatment. Now, when I'm talking about intervertebral disc herniations and bulges, there are quite a few different options, but I tend to look at and consider 3. Now, the first of those 3 options is waiting it out, hoping that the disc reabsorbs on its own time, and continuing with exercise-based rehabilitation, trying to keep moving as much as possible. Now, on this topic, this section, it is very important to know and to consider that intervertebral discs, quite a large portion of them, can spontaneously reabsorb. There's a really good piece of research, meta-analysis on spontaneous reabsorption of intervertebral discs. And that actually says that on average, about 66% of these intervertebral discs will reabsorb spontaneously by themselves. Now, the thing to consider is that we don't know how long this can take, really depending on the person, how severe the bulge is, various different personal factors such as age, nutrition, smoking, BMI can all contribute and change the speed and rate of reabsorption if it's going to occur at all. So that is the first option really. You have the opportunity to just wait. If you're getting symptoms, live with those symptoms, manage them as best as you possibly can, and stay as active and mobile as possible throughout that period of time. The second option is surgery. So surgery is something that I always believe should be your absolute last port of call. The reason for this, and specifically with spinal or back surgery, is that you don't have that absolute guarantee that the surgery is going to reduce your symptoms and take away the reason that you went under the surgery for in the first place. Another thing is that with spinal surgery, there is also those a possibility of complications that you could potentially get some lifelong nerve damage as a result of that surgery. So it's not a case that happens in every situation, but it's a complication and it's a risk of going under surgery and going under under the knife. The third option is something that we offer here at Move Freely, which is IDD therapy. Now, IDD therapy is a decompression treatment. It's non-invasive, and the idea of the treatment is that we reduce the pressure on the intervertebral discs through a traction force, and that essentially puts that intervertebral disc into the best environment to allow and promote healing and reabsorption of that disc, thus reducing the symptoms and reducing the irritation to the nerve. Now, not everybody is absolutely suitable for that. There's various different contraindications and conditions that can happen within the spine that prevent people from being put forward for IDD therapy. But it is a non-invasive option, and we do have and have had quite good success with reducing symptoms to very manageable levels, or to having no symptoms at all and people returning back to full function, which is absolutely fantastic. It doesn't happen in every single case, but we do have a very strict and set list of criteria after a fuller assessment that allows us to either establish if we think that you would be a suitable or a non-suitable candidate for that treatment. So IDD therapy is something that you could look at as well as a potential treatment option. And you'd be doing rehabilitation alongside that, as you would be doing if you were just waiting for the spontaneous reabsorption of the intervertebral disc. So that's a little bit of information about slip discs. Hopefully that's cleared up some misconceptions and given you a little bit more knowledge on the area and the topic. If you do have any other questions, please feel free to get in touch, either about just general physiotherapy, or if you think that you might be an appropriate or suitable candidate for IDD therapy, then give us a call and we can take it from there.